Hello everyone, this is Vamshi Krishna. Welcome to my YouTube channel. Today we will see some of the interesting MCQs for upcoming nursing recruitment examinations. The first question is, diagnose the condition below shown in this picture. So here you can see the hand of the patient. So what is the condition of this picture hand? The options are option A, ulcer, option B, gangrene, option C, phlebitis. The right answer is gangrene. We can see the gangrene over the tips of the fingers. The next question is, what is the meaning of debridement? So what is the meaning of debridement? The options are new formed tissue, option B, dead cells, option C, blood cells, option D, muscle tissue. So here in this picture the doctor is removing the tissue from the wound. What we call it is? The right answer is dead cells. So after the wound, after the injury when the injury is infected with the bacteria and viruses, the injury will become wound. So to heal the wound, we need to remove the debridement. Debridement is nothing but dead tissue from the wound. The next question is, what is the meaning of anasarca? So in this picture the child is in which condition? The options are mixed edema, pitting edema, severe generalized edema. The right answer is option C. Severe generalized edema is also known as anasarca. So the edema will be present all over the body. The next question is, what is osteosarcoma? So what is the meaning of osteosarcoma? The options are tumor of the liver, tumor in the bone, tumor in the brain. The right answer is tumor in the bone. So osteo in the sense it is always related to the bone. Sarcoma is the cancer or tumor cells formed in the bone tissue. The next question is, what is gliomas? Okay, what is gliomas? The options are tumors in the brain, option B, tumors in the lungs, option C, tumors in the testes. Testes also known as testicles. The right option is tumors in the brain, also known as gliomas. The next question is, study of the cancer cells. So when we are studying regarding the cancer or cancer cells, what we call? The options are oncology, option B, dermatology, option C, ophthalmology. I think this is really very easy question. The right answer is oncology. Oncology is a study about the cancer cells. The next question is, leukemia is a malignancy related to what? The options are bone, skin, and blood. The right answer is blood. The leukemia is a blood cancer related to the white blood cells. The next question is, which is the specific diagnosis for chronic myeloid leukemia? So when the patient is having the myeloid leukemia, so what is the specific diagnosis for the positive of the chronic myeloid leukemia? The options are option A, bone marrow aspiration, option B, bone x-ray, option C, lymph node biopsy. The right answer is option A, bone marrow aspiration. When we are aspirate the bone marrow, we can Identify the perfect diagnosis of the chronic myeloid leukemia. The next question is identify the instrument or the tool below shown in this picture. So here you can see the a rubber instrument which is used in the hospital. So what we call it is, the options are urinary catheter, option B stethoscope, option C chemoport. I think most of the people doesn't know about this instrument. The right answer is, the right answer is chemoport. Option C is the right answer. So what is the use of this chemoport instrument? The chemoport is being routinely used to administer the chemotherapy. So chemotherapy is we are using for the cancer patients. Okay. So for them only this chemoport can be used. Blood and blood products, total parental nutrition, and also for to draw the blood for investigation. So for the chemotherapy patients, by this chemoport only, we can give the parental nutrition, nothing but IV fluids. Okay, so administer the medications and to collect the blood investigations. Okay, so we can use this chemoport. Please remember this. The next question is, the severe weight loss accompanied by progress, weakness, loss of appetite, anemia, that is usually associated with advanced cancer is called. So here in this the picture, the patient became very thin, okay, severe anemic. So in the case of cancer patient, so in this stage of cancer patient, what we call, the options are carcinomatosis, option B cachexia, option C anaplasia, option D dysplasia. The right answer is cachexia. Cachexia is nothing but the last stage of cancer. So in this last stage, the patient may going to die. So in this stage, we can call the patient is cachexia. So the next question is, the cancer tumor of the hyaline cartilage is called. So that when the tumor is arised from the hyaline cartilage. So in this case, in this condition, what we can call the tumor? The options are osteochondroma, osteosarcoma, enchondroma. The right answer is option C, enchondroma. So enchondroma, also known as the tumor cells formed from the hyaline cartilage. So the next question is, what is the aim of palliative care? So we are giving palliative care for the patient. So what is the aim for giving this palliative care? The options are care for mentally disabled patient. Option B, care for the relief of pain, symptoms of a disease to improve the quality of life. Option C, radiation therapy. The right answer is option B. So the aim of palliative care is to relieve the pain, symptoms of a disease and improve the quality of life. But we are not preventing the disease. Okay, just remember, we are not preventing the disease, we are not controlling the disease, but we are improving the quality of life of the patient. So lifelong disorders like AIDS or some cancers, so in that cases the patients will come under the palliative care. So we are just to relieve the pain and symptoms and to improve the quality of life. That is nothing but palliative care. So the next question is, What is the drug of choice for chronic hepatitis? So in the case of chronic hepatitis, which drug is the choice for giving for the patient? The options are delaviridine, option B, ribavirin, option C, entecavir, option D, maraviroc. The right answer is option D, maraviroc. Maraviroc is a drug of choice for the chronic hepatitis B. So the next question is, so here you can see the colorful skull. Okay, this is really beautiful. The next question is the number of cranial bones. So how many bones are present in the cranium? Okay, so here we have the skull. The skull is divided into two. One is facial and one is cranial. So the question is, how many number of bones present in the cranium? The options are option A 6, option B 8, option C 9, option D 5. The right answer is option B 8. So in the skull, the cranium side having the 8 bones. The bone are 2 parietal bone, 2 temporal bone, 1 frontal bone, 1 occipital bone, 1 is ethmoid bone, 1 is sphenoid bone. The next question is, shoulder girdle consists of how many of bones? So we have the shoulder joint here. The joint formed with how many bones? Each joint. The options are 4, option B 7, option C 8, option D 6. The right answer is option A. So each side of the shoulder joint has the 2 pairs of bones. So totally 4 bones. The next question is, what is the example of gliding joint following below? In these options, which is the gliding joint? The options are wrist joint, option B, shoulder joint, option C, elbow joint, option D, ankle joint. The right option is wrist joint. So here we can see the wrist joint. So this joint is come under the gliding joint. Gliding is nothing but one bone is occupies the on another bone. So one bone will be like this. So on this bone another bone will be move forward or backward. So it is called gliding. Okay, gliding is nothing but moving on one object with another. The next question is the connection of tendons among. So the question is what the connection between the what of the structures. The options are bone and bone, option B muscle and bone, option C muscle and soft tissue. The right answer is muscle and bone. So here you can see the bone and here is the muscle. So the connection between the muscle and bone is by the tendons. Okay, the tendon is the tough structure which connects between the muscle and the bone. So the next question is the example for irregular bone in the human body. The options are femur, vertebrae and carpal bones. The right answer is option B, vertebra. So here you can see the vertebral bone. So it has the no perfect structure. So that we call it is irregular bones. The next question is sagittal suture present between the options are two parietal bones, frontal and parietal bone, maxilla and mandible bones. The right option is two parietal bone. So between the two parietal bone we have the sagittal suture. Suture is nothing but the connection, the fixed joint. It is also called fixed joints. The next question is intramuscular injection site for infants. So in the case of infants, which is the best site for giving intramuscular injection? The options are deltoid, option B ventrogluteal, option C vastus lateralis. Option C is the right answer. Vastus lateralis is the best for choice giving IM injection in the case of infants. Okay, so here we have the vastus lateralis muscle on the thigh. So here we have the thigh. So left side, lateral side, we have the vastus lateralis muscle. The next question is periosteum present over the which part of the body? The options are liver, kidney, this is kidney and skin. Option B, option C is the bone. The option C is the right answer. So over the bone we have the periosteum, so which covers the bone. The next question is Haversian canal present in? The options are option A liver tissue, lung tissue, bone tissue. The right answer is bone tissue. So in the middle of the bone, so here we have the bone tissue over here. So we have the lines. So these are called Haversian canal. So from this the blood and nerves will be circulate. The next question is how many pairs of ribs are called floating ribs? The options are first two pairs of ribs, last two pairs of ribs, or option C is the total ribs. The right answer is last two pairs of ribs. So here you can see the last two pairs back of the thorax. So it will be lying on the back of the thorax. So these two pairs are called floating ribs. So floating ribs are nothing but the ribs cannot be attached with the sternum. So it is not attached to the sternum, so it is called floating ribs. The next question is the ligaments are the connectors between the options are bone and bone, option B bone and muscle, option C muscle and bone. The right answer is bone and bone. So here we have the ligaments. Okay, so these ligaments are the connectors between the one bone and one bone with another bone. The next question is the average length of vertebral column. So here we have the vertebral column. What is the normal average length of vertebral column? The options are 71 centimeters, option B 73 centimeters, option C 69 centimeters. The right answer is 71 centimeters. The next question is sesamoid bone also known as. So what we call otherwise, what is the other name for sesamoid bone in the human body? The options are patella, option B femur, option C metacarpals? The right answer is patella. The patella is the kneecap, also known as patella, which is present in the knee joint. Okay, here we have the small bone. It is also called sesamoid bone. Sesamoid bone is nothing but which is formed by the tendons. So it is called sesamoid bone. The next question is the most prevalent bone disease in the world. The options are arthritis, option B, rheumatic arthritis, option C, osteoporosis. The option C is the right answer. Osteoporosis. The bone will become very fragile, so it is easily to break. So it is called osteoporosis, porous of the bone. The next question is what is carpal tunnel syndrome? The options are compression of radial nerve, option B compression of the medial nerve, option C compression of the sciatic nerve. The right answer is option B compression of the medial nerve. So it is called carpal tunnel syndrome. The next question is the which condition is known as humpback? So in the buffalo we can see the hump. Okay, so the buffalo will be looks like this. So on the buffalo we can see the hump. Okay, so in this condition, in this name comes under the which condition? The options are option A scoliosis, option B kyphosis, option C lordosis. The right answer is kyphosis. Option B is the kyphosis. So in the case of kyphosis, the vertebral column will be turned like this. Okay, this is the hump area. The next question is total number of bone in the human body. This is very easy question. The options are 106, option B 206, option C 306. These are not police constable numbers. The right answer is 206. Okay, 206 bones are present in the human body. The next question is the total number of facial bones. Already we have seen the cranial bones. Now we will see the facial bones. The options are option A 13, option B 14, option C 15. The right answer is 14. The 14 bones are inferior nasal conchae are the two lacrimal bones, two maxilla and mandible bones, two nasal bones, two palatine bones, wormer zygotic bones or zygoma. These are two bones. Totally 14 bones are present in the facial and the cranial bones are 8. The next question is name the condition below shown in this picture. So here we have the one beautiful lady standing. What is the condition of in this picture? The options are kyphosis, lordosis. So the right option is lordosis. So the lordosis is the curvature of the vertebral column to the anterior side. Okay, When the vertebral column is turned into the back side, it is called kyphosis. And when the vertebral column is turning lateral side, it is called scoliosis. The next question is, identify the deformity in this picture. So here we have the two vertebral bones and disc and spinal cord. The options are nerve damage, herniation of the disc, option C, bone deformity. The right option is herniated disc. So here you can compare the two pictures. The part of the disc is herniated towards the nerve. So when the part of the disc is herniation or protrusion, or which give the pressuring over the nerve, so the part of the nerves will become very painful. So in the case of sciatic nerve compression, the disc prolapse will be occur. The next question is, name the first bone of vertebral column. So we have the vertebral column here. Which is the first bone? The options are axis, option B atlas, option C coccyx. The right option is atlas. Atlas is the first bone of the vertebral column. And also you can remember that is atlas is the brand olden days cycle in India. By this you can remember easily. The next question is, name the second bone of the vertebral column. So we already know the first bone. Now we will know the second bone. The options are axis, option B atlas, option C coccyx. The right option is axis. Axis is the second bone. The first one is the atlas, second one is the axis. This is the end of my class. Thank you guys for watching my video. Please subscribe and share this video for the people, for the students who are sincerely studying for the examinations. All the best guys. Thank you.